Draw the meeting to order, and can I welcome everyone to this, the fifth meeting of the Public Petitions Committee in 2017, and can I remind members and others in the room to switch phones and other devices to silent. The first agenda item is on current petitions, and we're taking evidence on petition 1480, Alzheimer's and Dementia Awareness, and petition 1533, abolition of non-residential social care charges for older and disabled people. The petition 1480 is by Amanda Copel on Alzheimer's and Dementia Awareness, and petition 1533 by Jeff Adamson on behalf of Scotland Against the Care Tax on the abolition of non-residential social care charges for older and disabled people. I'm delighted to say we are joined this morning by the Cabinet Secretary for Health and Sport and their officials, David Fotheringham, Head of Adult Social Care, and Mike Liddell, Policy Manager, and can I welcome you all to the meeting. We do have limited time this morning, and the intention is to move straight to questions from the committee, if that's acceptable. If I can maybe start on behalf of the committee, Cabinet Secretary. In your submission to the committee dated 2nd November 2016, you explained that the Scottish Government is conducting a feasibility study into expanding free personal care and nursing care to people with dementia under 65. And I understand this is due to be completed in summer this year, and the committee would welcome a copy of this study when it is published. You will also recall that you have previously given evidence in petition 1480 by Amanda Copo to the Session 4 Public Petitions Committee on 6 October 2015. And at that meeting you explained that, quote, "We are absolutely trying to avoid lists of conditions because we will always miss one, and that will be the condition that will form the basis of the next petition to the committee." It would seem from the details we have in the feasibility study that you are focusing on dementia. The petitioners for petition 1533 argue that this scope of the study should be extended to include people with disabilities. And I wonder if you could explain why you've decided to focus on a specific condition while acknowledging that this approach will be criticised.
No, just for clarification, the feasibility study, and first of all, thank you for the opportunity to give evidence this morning, but the feasibility study will look at the feasibility of extending free personal care to all those under 65. I don't know if you're aware, during the members' debate on the 6th of December last year, this issue was explored and members were asking that we should be looking at all conditions. And as I've said previously, I think it would be difficult to look at one condition. And in consideration of the views of members during that debate and the challenges and difficulties of looking at one condition and how challengeable that would be, and basic fairness, we have agreed that the scope of the feasibility study will look at all those under 65. So hopefully that will give you the clarity that you're looking for.
Okay, so you've opened it up beyond dementia then?
Yes.
Okay. Thank you very much for that. Maurice?
Good morning. Calls will be made to establish a cross-party working group to consider what a fair social charging system would look like, and what would it cost. Can you update the committee on whether discussions on this have taken place, and what has been the outcome?
So I think we need to do this in an orderly manner, in that the feasibility study will give us a lot of important information for us then to be able to make some informed choices about the way forward. At the point that we get the feasibility study, I think that would be the point at which to have discussions with members of other parties. I would be very happy to do that. I think I gave that commitment during the members' debate, and I would be happy to give that commitment again today, because then we'll have something to talk around rather than talking around before we actually have that information in front of us. So I think that would be the best process, but I'm very happy to confirm that once we have that feasibility study, happy to engage with members from other parties.
Thank you. Can I ask a supplemental, Chair? Can you confirm whether any stakeholders are represented in the feasibility study, and whether it is on track to be completed by summer this year?
Yes, it is on track. The feasibility study is being taken forward by Scottish Government officials and analysts, with talking to local authorities and making sure that we get the right information. However, I am happy to ask my officials to meet with stakeholders that want to discuss this further and to keep them informed of the work that we're undertaking. And again, once the feasibility study is published, again, very happy for that to be obviously brought to the committee, as you've asked, convener, that the committee get a copy of that. Very happy to confirm that, and very happy to confirm that stakeholders could get a copy sent to them if they want to discuss it further once they've seen it. Be happy to do that.
Right, thank you, Chair.
Can I ask on the cross-party group, there is it's a slightly different proposal, I think, to maybe have a meeting with folk who are interested to look at the report, but the suggestion of actually a cross-party working group, and perhaps with stakeholders as well, looking at that feasibility study and seeing what the challenges of implementing. Is that something you would at least consider?
Happy to consider that. I mean, hopefully the information we get in the summer will give us some maybe clearer options of the way forward. Obviously, it has to be deliverable. The options have to be affordable, and they have to be fair and consistent. So what we need to have, first of all, is the information in which to be able to make some informed decisions about what is possible. Whether that's an initial meeting cross-party to look at that, if there's then a view that we should continue those cross-party discussions, I'm not going to rule that out. I'd be happy to consider that further.
And in terms of those stakeholders or indeed the petitioners, at this stage, they should simply be contacting your officials in terms of perhaps feeding into the feasibility study?
Yes, absolutely. Yeah.
Okay. Brian Whittle, thanks.
Thank you. Good morning. You've explained in previous evidence that there are various models that could be implemented in making the charging regime fair. One approach you've mentioned is to reconsider the threshold at which people start to pay charges. You explained that the income threshold that determines when people will begin to pay charges will rise from 16.5% to 25%. The petitioners from Petition 1533 are concerned that a blanket increase in the social care charging threshold will not reflect relative costs of living in different parts of Scotland. What's your view on whether applying blanket thresholds promotes a fair charging system?
Well, first of all, we have taken action around the threshold, and of course we did raise the threshold from 16.5% to 25% above the pension credit guarantee or the income support personal allowance and disability premium allowances. And we did that because we felt it was in making charging fairer, which is our aim, that actually starting with those on the lowest incomes was the fairest thing to do, and that's why we took that step to raise the threshold. We also, of course, have taken other action in terms of those who are members of the armed forces, having their war pensions disregarded in terms of income assessment. And of course, there is already the position of those who are in the final 6 months of their life and making sure that local authorities are not charging where someone has a terminal illness. So I think there's been steps taken already around that. But in terms of the issues raised around whether or not there should be differing thresholds in different parts of Scotland, I think we would want to make sure that we also listen to stakeholders who tell us they want greater consistency in charging policies across the country. That's been raised with me by a number of members within Parliament over the years and recently as well. I think moving to different charging thresholds in different parts of the country would seem to me to be counter to the idea of greater consistency. And I think in taking forward the feasibility study and the information that gives us in the summer, I think trying to achieve greater consistency would hopefully be one of the principles rather than less consistency across Scotland. And I think having different charging different thresholds in different parts of Scotland, I think would lead to greater inconsistency. And I think members on balance are asking me for greater consistency rather than less consistency.
Okay. Thank you. In the debate on the 6th of December last year, you explained that COSLA have implemented a new standard financial assessment tool and should reduce the variation in local authorities' charging regimes. The petitioners for Petition 1533 have been very critical of the ability of this tool to meet the aim and argue that there is evidence that variation continues and some local authorities have increased their social care charges despite the tool being in place. What assessment has been done of the impact of this tool and its effectiveness at meeting this aim?
So, COSLA's standard financial assessment tool is in the first year of operation. and COSLA have said that they will monitor its impact, and we would obviously expect them to do that. I want to see greater consistency and fairness in the system, as Ed said earlier in answer to the previous question. And while we do have powers to require local authorities to charge or not charge for any particular aspect of social care, the partnership agreement we have with local government means that local authorities should retain that local accountability. They're very keen that that's the case. And I think where we are just now making progress on fairer charging, that's where we would want to remain. So although the power does exist for government to mandate these things, I think the way we've worked with local government in trying to reach agreement has been to tackle these things in a different way, and that's why the standard financial assessment tool, I think, is important. But I can say to the member, I will continue to discuss with COSLA the monitoring of that and the implementation of that. We do need greater consistency, and I think we need to see that local authorities using that financial assessment tool to achieve that.
Thank you.
Okay, Rona Mackay.
Yes, good morning. Just following on from that, you have previously explained that if the variation in charging regimes doesn't improve, you might consider using legislative powers to ensure that happens. Just wondering if you could say at what point would you consider introducing that legislation, and how would you use this approach to diminish the variation in charging?
Well, as you say, that power has existed for a number of years now. However, I think the approach we've taken, as I said earlier, has been one of partnership, and what we've attempted to do is to achieve greater consistency. COSLA have worked with us on that in terms of the assessment tool. And of course, we have taken the action around raising the threshold, around terminal illness, around armed forces veterans receiving the full value of their war pension. So it's been an incremental approach, rather in terms of improving and making charging fairer. I would see that continuing, and I would hope that the feasibility study that we get in the summer will help to be able to reach a consensus on the way forward, including a consensus with local government on the way forward. And that would be my preference, certainly, than having to tackle this in a different way. So that for me is the better route forward.
And would that be your absolute last resort?
Well, it remains there. It has always been there. I think that power was brought in when free personal care for the elderly was 2002 was brought into legislation. So that power was there as a backstop, I guess. But I think we would want to avoid doing that if we can work with local government together to get to a fairer charging position. I think we've already made progress. I've outlined some of that, the thresholds, armed forces, veterans, and those in the last 6 months of life. But there's more to be done, and I would expect to do that in partnership with local government, and they would be very much involved in the feasibility study that will be published in the summer.
Thank you.
Okay, Angus MacDonald.
Okay, thanks, Convener. Good morning, Cabinet Secretary. You've mentioned the standard financial assessment tool. So following on from that and your commitment to work with local authorities, the petitioners for PE 1533 raise some concerns about the democratic accountability of social care charging, and in their view the integration of health and social care has made it less clear which body is responsible for setting policy in this area. So what's your view on this, and how should councils and IJBs be working together on this issue in practice and communicating clearly with members of the public who use social care services?
Well, the integration of health and social care has, as you know, established a new relationship between IJBs and between health and local government and other partners around the table. And we would expect that when considering the provision of social care services, that all of those partners should be in dialogue, and that those discussions would take into be taken into account when reaching decisions on social care charging. However, ultimately, the framework for the setting of charges remains clear, and that is that social care charges are set by the local authority, taking into account the guidance produced by COSLA that we were discussing earlier, and the other guidance that they have produced. And the guidance makes clear a number of things, but importantly, the need to ensure that people have good and clear information about available services and the types of charges that might apply. And it recommends that all councils provide charging information in a standard format on their council website, and the information about benefit entitlement should also be available. So, ultimately it's for local authorities to decide. I guess in terms of democratic accountability, if local authorities make decisions that local people don't like, then it's for local people to make their views known about that. And obviously there's an opportunity to do that through the ballot box. If a local authority has produced a policy around charging that local people don't favour, then that's where ultimately the democratic accountability is exercised. But hopefully that just explains, in terms of the new integrated landscape, that local authorities still retain the authority around charging.
Yep, that's fine, Cabinet Secretary. Thank you. Dr. Capel has raised concerns about the 6-month end-of-life guidelines, arguing that it's often difficult for practitioners to assess whether someone's in the final 6 months of their life. You've previously explained that once a DS 1500 form has been completed, that a person will not be chased by the local authority if their prognosis continues beyond 6 months. Can you explain what written guidance there is to support this policy, and are you aware of any complaints that this is not being followed?
Okay, well, this is a very, very important issue, and COSLA's charging guidance recommends that local authorities use their discretion to extend the waiver of charges beyond 6 months. Now, we would expect all local authorities to follow that. And I'm not, I have to say, aware of any evidence that this isn't being followed. But if members have any evidence, I would be very happy to look into any instances where the guidance isn't being followed, and to, if need be, work with COSLA to clarify their guidance, because it's really important that no one in the last stages of a terminal illness is charged for the personal care they receive at home. And if there is any evidence to the contrary, I would be keen to see that, and I would certainly take action accordingly. So it's important that we continue to monitor that, but if there is any evidence, I would want to see that.
Okay, thanks, Cabinet Secretary. If this committee does have any evidence, we will forward it to you.
Okay.
Thanks very much. Can I maybe ask a bit about, well, there's a couple of things. First of all, on the question of disability-related expenditure, you'll be aware that in England it's a legal requirement to take account of any additional expenditure related to a person's disability. It's not the case in Scotland, and it would seem that the overwhelming majority of local authorities in Scotland make no allowance for additional costs, and that therefore is an issue in terms of people's ability to fulfil their potential, to be able to work elsewhere, if that's simply not recognised in the charging regime. Is this something you would look at?
Well, I think we'd want to continue to discuss with local authorities what is disregarded and what's taken into account as we take these issues forward. I mean, there is variation in terms of the practice across these islands. I mean, in terms of the income that is disregarded, and then the buffer on top of that is designed to try and make sure that the income that people are left with is adequate to not just pay care charges, but to meet other needs as well. But I guess that's something we would want to keep under review. Do you want to say anything, Mike, about the difference?
I don't know, David might.
Is there anything, David, you want to?
Not really. I mean, obviously, the disability benefits that people get should be taking into account their relative needs, and we'll be getting additional powers in relation to some of those things.
But specifically in England, it's a legal requirement to take it into account, to have a proper assessment of what are the things that are added costs to somebody because of their specific disability, rather than a general, you have a disability, so you tick that box and that's therefore the charging regime, but specifically assessing the person on the basis of what the extra expenditure that comes with their particular disability, and for some people it can be very, very significant.
So more of a needs-based assessment.
Is it something that you would at least look at?
I think it's something we could take into consideration and explore further. I mean, I think David's point about the fact that we are getting some welfare benefits devolved enables us to, I guess, to have a look at all of these things and to perhaps take a different approach. But it's certainly something we'll give some further consideration to.
And I suppose the other kind of issue that's behind this, I mean, I think in terms of the first petition, which is this question of you've got dementia and you're under 65 and you don't have access to certain supports, that's very clear in your feasibility study, is looking at the second petition, which is really about whether at the point of access to services, these should be free at the point of need. That is not something the feasibility study is looking at, as I understand it, but I wonder whether, or what is your view on what I find quite a compelling argument, which is this is a human rights issue, that we should all be entitled to achieve our potential, we should have the supports that allow us to access work, education, or whatever it might be, and that we have currently a care regime or a funding regime that denies people that right. This disability-related expenditure is part of that, but that if we have a system of support and care which is not very closely connected to people's individual needs, do you see the argument around it being a human rights issue?
Well, I think someone being able to live life to the full and being supported to do that is a basic right. So I would agree with you to that extent. I mean, I think we also have recognised that in some of the policies that have been taken forward. So if we step just outside charging for a second and we look at things like self-directed support or the Independent Living Fund, which has been continued in Scotland unlike elsewhere, I think those are examples of resources that are being used to very much enable people to live the life they want to live, be able to continue to work, for example. And ILF, of course, supports people to remain independent at home and indeed to hold down a job and to go about their daily lives. And SDS, again, is on the principle of a personalised support that the person can, live life as they would wish to, rather than perhaps being restricted by the fitting into the services that are available. So that is all on the basis of empowerment, personalised care and being able to live an independent life. So I think to that extent, I've got sympathy with what you're saying. I mean, in terms of taking forward the fairer charging policy, I mean, it is with a view to obviously maximising people's independence, the quality of care they receive, and also making sure that they're not accepting support because of charges that they may. And I think that's where we want to assess things like unmet need, for example, which the feasibility study will look at, because there may well be people out there who currently are not accepting support because of the charging regime, and that is a concern, because obviously that means that they might not be living, not just living life to the full, but they may actually have severe difficulty in their day-to-day lives because of that. So these are the things that we need to look at.
I mean, I think there is an issue, and I note what you say about Independent Living Fund, and you've continued it for those who are already in it. But there are no new applicants to Independent
Well, there will
Living
be.
Fund.
There's resources available for new applicants to ILF. I think it was 5 million. So there will be the ability for new applicants to apply, but the focus has been on establishing the infrastructure around that, and that's taken some time and making sure that the processes and the application processes are there, and I think there is an opportunity as well, as we get some of the welfare benefits devolved, to join the dots a bit more effectively around the supports that are available, whether that's mainstream care support through local authority or third sector providers, whether it's SDS, ILF, and indeed some of the other benefits that will be devolved. I think there is an opportunity over time, certainly, to bring more of a coherence to those and focus a bit more on what is it the person needs to be able to live a fully independent life.
I suppose the human rights approach would mean that the answer was it's too expensive would not be an answer, it would be an unacceptable answer. And that's something that I think the campaign is exploring, and certainly a number of us would be exploring this question. You wouldn't say, well, universal education is too expensive, so we'll just educate our boys. I think that's really the kind of issue around there. The final question I have is really around what your understanding of the definition of care is, because some of the evidence we've got is that the kinds of support that people require, it's not just physical care, but there are other things that allow you to be an active citizen, to work and so on, which wouldn't be a very narrow definition of care. Are you concerned that, and local authorities have obviously very significant budget constraints in what they're doing, but are you concerned that perhaps generally we have a definition of care which doesn't actually recognise this question about people's entitlement to be able to achieve their full potential, and in fact are inhibited what they're doing because we have quite a narrow definition of what care is?
I think because of the free personal and nursing care policy, it was necessary to define what was meant by that in terms of entitlement. And given we are living in a situation where finances are not infinite, and therefore there has been a focus on the support needs around personal care, and the prioritisation, I guess, of people's needs, and those who have the greatest needs getting the support, and particularly around dignity and being able to remain living at home without that personal care input. Obviously, many people would not be able to, or indeed family and carers would have to provide all of that support without external support, and that would put pressure, huge pressure on them. So we'll always need definitions, I think, and the personal care has been given that level of priority because it's been recognised it is by nature personal, and it is about the personal needs, the washing, the dressing, getting up, help to go to bed, all of those things that are really about dignity. Whether or not it needs to be redefined, I think I would be cautious around that, because we do live within a finite resource. The focus of our attention at the moment is around what can we do around the personal care needs of those who are under 65. I would quite like to keep a focus on that and to try to see if we can resolve that issue in a fairer way before looking at the definition of personal care more generally.
Okay, thanks very much. Are there any final questions from the committee? No, I mean, I think certainly that in terms of the petitioners, there's clearly something. It's not going to resolve simply by a feasibility study, but that's something that obviously is going to provide a lot of information. But the very strong and compelling case that's been made around under 65s, but also this question of the variation across the country, what is defined as need, comparisons perhaps around disability-related expenditure and all those kind of questions, stuff that we maybe want to look at further, but I appreciate very much the evidence that you've given thus far. I wonder if the committee has a view on what we do now. I think we maybe want to take the opportunity to reflect on what the Cabinet Secretary has said, will be clearly a critical milestone when the feasibility study itself is published, and perhaps we can look at it further as a committee on the basis once we've kind of got to that point. That seem reasonable? Yes. Okay, so we'll take the opportunity to reflect on the Cabinet Secretary's evidence, and obviously the petitioners will have a view on this as well, and we can perhaps at a further meeting decide our course of action. But in the meantime, can I thank you very much for your attendance? I think that's been very useful, and can I suspend briefly? Can call a meeting back to order, and we're now moving to petition 1577 on adult cerebral palsy services. Can I welcome Murdo Fraser to the meeting for this item? So the next item on the agenda is petition 1577 by Rachel Wallace on adult cerebral palsy services. We're joined this morning by the Minister for Public Health and Sport and her officials, Dr Gregor Smith, Deputy Chief Medical Officer, and Elizabeth Porterfield, Head of Strategic Planning and Clinical Priorities. And can I welcome you to the meeting this morning? We have a bit of time, so I wonder if you want to make an opening statement, then we would be happy to hear from you.
Well, okay, I understood that the committee had wanted to go straight into questions. However, yes, I thank you for the opportunity to respond to Rachel's petition. I got the opportunity and privilege to meet with Rachel last week, along with her MSP Murdo Fraser, and got a chance to explore some of the issues that she had concerns about, and I think it's a tribute to her for articulating those concerns and trying to make a difference and trying to make improvements for others that suffer from cerebral palsy across the country. We undertook to explore further some of the issues that she raised around physiotherapy access, and also around the the main point that she had been trying to articulate around a national clinical pathway, and I think those will be some of the questions you'll want to probe us a wee bit about today, particularly around our work, ongoing work with Bobath Scotland about that the local pilot in West Dunbartonshire, which we think and hope will go a long way to reassure Rachel about the action we're taking to address the concerns that she's raised. We have also undertaken to work with Rachel on a range of different activities to ensure that we can provide her with a bit more reassurance and comfort that the action we're taking addresses her concerns. And I'll also instruct my officials to explore a bit more fully with NHS boards across the country about their provision and how they're helping to cope, helping people with cerebral palsy to cope with that transition. I think that's an issue that I think a lot of people with disabilities or conditions face, that those tough transitions from children's services into adult services, and I think that's something that we should explore, not just in terms of NHS Tayside where Rachel lives, but across the whole country. And I think that will complement the work that's already been undertaken by Capability Scotland in their mapping exercise and the work that Bobath Scotland is taking with the pilot. So I think together we'll get evidence, information that will allow us to take forward a framework that provides reassurance to Rachel, provides, I hope, reassurance to the committee, and we'll keep the committee updated with the progress that we make to make the differences that Rachel is keen for us to make across the country.
Okay, thanks for that. Obviously, you'll be aware that this petition was carried over from Session 4, Public Petitions Committee, and as you say, you're funding a pilot project being led by Bobath Scotland in conjunction with the West Dunbartonshire Health and Social Care Partnership. And Scottish Government has described this pilot project as, quote, an alternative supported pathway for adults with cerebral palsy. And I think the suggestion appears to be that Scottish Government will not consider the needs for a national clinical pathway until this pilot programme is completed. I wonder if you could explain the scope of the pilot, just for the record obviously, and why it's described as an alternative supported pathway for adults with cerebral palsy in circumstances where there does not appear to be an established clinical pathway.
I might ask Gregor to kind of explain more fully for your benefit around the processes for a national clinical pathway, but certainly in a broader sense, national pathways are delivered for more specialist conditions that require fewer interventions from clinicians and from less providers. So because of the range and ways that this condition can manifest itself, and because it relies very much on a variety of providers both across health and social care, that means that there is much more merit in having a more local and bespoke way of ensuring that people get the care that they need. So that's why we're keen to get the learning from the Bobath pilot in West Dunbartonshire, understand the learning that has been amassed during the 18-month period of this pilot, work then alongside the work that's ongoing from Capability Scotland and their mapping exercise, and then I think what we'll be able to do is kind of develop a framework that will allow us to have some national principles that will enable there to be a bit more consistency felt across the country. But certainly that's why we don't have, we won't be proceeding with a national clinical pathway, because the way in which this particular condition manifests itself doesn't necessarily allow itself to easily be translated into that course of action. So that's why we want to make sure that local activity is as good and as strong and as robust as it can be, and that's why we're proceeding with this pilot to amass that evidence so that we can then proceed with that evidence backing to ensure that local services are delivered in an appropriate way and a timely way. But Gregor, would you like to expand on that?
Good morning, everyone. So we've got a couple of decades of experience of developing pathways now, both at a local level and at a national level, and a better understanding of what conditions lay themselves to be very open to the development of pathways in either of those manners. When the description is made here of an alternative pathway, I think it's an alternative approach would be a better description. So traditionally what we've done when we've developed a clinical pathway, if you go back to the first pathway work that I was involved in the early 2000s, what tended to happen was a group of clinicians, experts, we would get together in a room and they would examine the evidence for a particular approach to care, look at the contributions from each of those professionals in terms of a pathway, and develop a pathway with supporting data to assess the quality of care along that. That approach probably has become very much less used now. And what we have is a very different approach, where much more use of co-created pathways, working with patients and the public to develop a pathway. The alternative sense that Beau Bath had described this pathway in is what they wanted to do in terms of the development of the pathway, was to develop it very much from the service user up. So working very closely with people who have experience of cerebral palsy, looking to see exactly what their needs were, and develop the pathway using evidence around about their needs. So that's why the term alternative pathway has been given here. And as the Minister has already explained, for a condition like cerebral palsy, there's a number of different, if you like, influencing factors when the approach to developing a pathway is considered. And one is about what kind of evidence base exists for that pathway already. Is there consensus around about that evidence base? Is there the data to support the development of a pathway? Is it a high volume specialty? Is it a particularly specialist type of service that would be needed? And then considerations taken as to whether that's necessary then on a national basis or at a local level. And I'm certainly convinced by the argument that in the case of cerebral palsy, what's required is a stronger evidence base developed from the ground up that informs a national framework for services, so that local pathways can be developed for people to receive care at that local basis.
It does feel illogical to me to say that this is too complex to have a national. Because it's a complex condition, you can't have a national pathway, and it has to be started at a very local level, which presumably will be very local. But it's, I don't understand, certainly from the petitioner's point of view, her description of having a whole series of people round about her as a youngster moves into adulthood and she has to go and find out all of these supports for herself. It feels pretty basic to have a system in place where she would have somewhere to go where those services would be identified. So the definition of something being too complex to have a national pathway doesn't feel to me to make sense. And even if it were the case, I'm not getting the logic of then saying you therefore have this wee pilot in one particular area that's going to tell you everything about the condition right across the country. So
if I've suggested that it's the complexity which...
I think it was the Minister who said that. You said that it was too complex.
No, I don't... Well, if I used... what I think I said was that the condition manifests itself in a different number of different ways, and that means then that there needs to be a cognizance of that, and which is why, as Gregor said, if we have local pathways, that will allow us to take a much more holistic picture of the individual patient, their individual needs, ensure that they have the appropriate transitions in place, and that local services are delivered around that patient in a way that allows them to seamlessly move from, in Rachel's case, from children's services into adult services. So that was why I said that there was, at this current point in time, no plans to develop a national clinical pathway, but actually the Beau Bath work is important. It's not just a local pilot, it is something that's going to develop and enhance our understanding of the condition, the way in which services are provided and delivered, and how we can then upscale that and make sure that there are principles across the country that are understood, so that people don't, as Rachel has herself described, that have that feeling of falling through the cracks at that point of transition. And that's why I've also undertaken and will undertake to ensure that we engage with every single NHS board across the country to make sure that there's appropriate provision in place to ensure that those people don't fall through the cracks, because that's not what any of us wishes to see happening. And actually there should be in place already ways in which people are helped to move seamlessly from their children's services into adult services. And that's why, again, if we have much more rigour, a much better and clearer understanding of how services are delivered, which is what the Beau Bath pilot will offer us, then I think that will move us towards what I think, and I hope Rachel does want, is to make sure that that transition is seamless and that people feel supported.
I'm still not clear, that you say it has to be done locally because it's complex. You can't just have a national provision or a national pathway, but we don't have we aren't developing local services. We aren't developing local pathways. We have a pilot. Can you give us
a pilot to help us understand what we need to do to enhance provision across the country in a local sense, but have those national principles that we all understand will be useful and critical to ensure that that transition is much more seamless.
So is there a possibility that the pilot will lead to a national pathway? You're not excluding it as a possibility. If it's a pilot, is this something that might happen?
So one of the characteristics of national pathways, from a clinical perspective, tend to be if there's a really narrow range of providers who can give care to patients. So you've maybe got kind of one or two providers at a national level who would actually be delivering that care. That would be something which would be very tangible for a national pathway. What we're talking about, I think in this case of for the cerebral palsy pilot is the requirement to develop in that planning phase the robust evidence that suggests these are the services and the approach that are necessary at a local level by multiple providers in order that patients receive the best care possible. It's the best way that I can try to describe this. So national frameworks, national pathways tend to be for very narrow provider range, one or two providers throughout Scotland who are only capable of providing that care, but a framework which underpins local pathway development, allowing local care according to the needs of that population, is very much what the Bobath pilot will provide the evidence for. I hope that makes sense.
In your meeting with the petitioner, there was a suggestion in terms of how long this is going to take. It would take 10 years. Is that fair? Is that, I mean, that to develop a clinical pathway and framework for adults with cerebral palsy, it may take 10 years. I mean, would you agree that that's far too long? And are you going to put a timetable on developing this work?
I think at the time we kind of, in our discussion with Rachel, I think there had been a misunderstanding about that 10 years. So that wasn't the case, and we tried to give reassurance that to develop improvements around cerebral palsy won't take 10 years, and the Bobath pilot is 18 months, and that will help us then develop a framework along with other work that's happening across other neurological conditions, for instance Huntington's, that will help us to pull that together to ensure that we can develop the changes that I think Rachel said that she would like to see. So no, it won't take 10 years.
Okay, I think Rona Mackay would be helpful to come at this point.
Thank you, good morning. This might be a question for Elizabeth Porterfield. We know that there are other national clinical pathways in Scotland for other conditions such as motor neuron disease. I wonder if you could tell me roughly what it would cost to set up a national pathway, and if this has any bearing on what you're planning to do here.
No, I honestly don't know how much it would cost, but I do know that there would be, as Gregor has described, several layers and areas of work that would need to be progressed with people with cerebral palsy, involving them, as well as the specialists and the non-specialists and all the managers. This is possible to do. This is what the Bobath pilot has been looking at, how you do that locally with all the providers, because although there may be, and I use the word with quotes around it, specialist needs within a general service, if you like. Physiotherapy, they are all trained to provide physiotherapy for a variety and range of conditions and etc. for people. Defining that for someone with cerebral palsy obviously needs to be looked at for the individual. So yes, we can do that, but the costs would be the time costs of the people that need to get together to do that, which would be variable, but there isn't a specific cost attached to it, and cost has not at all entered into any thinking around this. We agree we need to do this, that's why we funded the pilot, to see how this can be done within the partnership context because of integration, because the needs are not all about healthcare services, there's also the issues around the join up with social care. So, and IJBs are responsible for commissioning these local services, which is why this needs to be done locally.
Can you remind us how much the funding for the pilot
It's
cost?
73,000 so far.
Okay. Thank you. Dr. Smith, do you wish to?
I think all I would want to say is I don't recognise cost as being a consideration in terms of the thinking about what qualifies for a national pathway and what needs work to develop local pathways. But it's not one of the considerations that people factor in.
And I think as well it's important, I think with what the discussion I had with Rachel as well, a lot of what she described was that she felt that there was, as is often the case in many areas of social policy and health policy, that if things had been identified earlier, if services and that transition had been smoother, then perhaps that wouldn't have been as costly, that she wouldn't have needed to have had more costlier services because some of the things would have been prevented that she's encountering now. So I think that's a real lesson as well about why it's important that we get services delivered in a holistic way around the person, that they are empowered to be in control of what services are delivered to them, that they are able to articulate clearly and feel that they're being responded to by local services so that they can avoid the more costly consequences of something not being identified and dealt with, costly in terms of their own personal health, but also costly in terms of the public purse. So I think the whole reason for developing this alternative pathway is also to embed that approach of early intervention and prevention, which is the right thing to do for the person, but it's also the right thing to do for the way we marshal public funds.
Yeah. Thank you, that's helpful, thank you.
I think the point is there is no transition though. I mean, in the experience of the petitioner, there was no transition. It wasn't that it wasn't terribly well organised. There was no transition.
Well, and that's why we've got this pilot in place to try and identify ways in which that can be dealt with adequately. But also what we don't have is what we want to make sure is that we have a better understanding of what other NHS boards are doing and whether this is particular to Rachel or whether this is something that we need to address much more quickly, which I think will then mean that the evidence that we're getting and the research that we're getting from the pilot will allow us to speed up some of that across the country.
So the work identifying what the health boards are doing across the country is working in parallel with the BOBAS.
Yeah, we will do. And Capability Scotland, I understand, although I've not been involved in that work, they're doing a mapping exercise as well, and they'll be identifying areas that need addressed, which will complement the learning from the BOBAS pilot, and also other work from other neurological conditions such as Huntington's Association, which are also developing a framework to help people cope with that, which I understand as well other neurological conditions are welcoming and want to build on and develop further, so it kind of doesn't just cater for Huntington's but develops for a suite of other conditions as well. So yeah, I think what we're doing at this point in time is gathering that evidence, gathering that research and making sure that we can proceed in a much stronger way and give that reassurance to Rachel that she needs.
Brian Whittle? Sorry. Yeah, on you go.
If I can perhaps just expand on this from a clinical perspective, it's utterly critical that work on transitions is led at a local level. Utterly critical, because the experience of transitions in other chronic diseases, whether that be asthma or epilepsy or whatever other childhood illnesses, transitioning into adult care, it's about how local services configure themselves, develop the relationships between clinicians and with their patients.
They must be shaped by national understanding of the issues around a particular condition, surely.
So,
I mean,
but that's
you're not
different.
Suggesting that everybody within a particular geographical area, their asthma is very specific to their local conditions.
But that's
so there
different.
must be a national perspective on how you would manage any condition, which then would inform the very local issues. Surely.
But that's different from a national pathway. So that's where you might get national guidance or a national framework which helps to support that local work. A national pathway would take us into a whole different spectrum of the approach to the way that we manage that condition.
But there's key principles across transition for any issue, whether that's any condition as well, about and that key principle is about those relationships and ensuring that services are delivered timeously to that individual and making sure that they feel empowered. In Rachel's case, unfortunately, that doesn't seem to have happened, and she's explained that to us. But what we need to,
well, with respect, I think she would suggest it's not just herself, but for people with her condition, that she would suggest that was an issue. But anyway, if we can progress, Brian Whittle.
Thank you. Good morning. Ms Wallace is calling on the Scottish Government to consult with stakeholders on the development of a clinical pathway. She is particularly keen for professionals in the NHS who are involved in supporting and delivering services for adults with cerebral palsy to be involved. And I wonder if this is something that you're prepared to do.
Absolutely, always keen to engage with people who have lived in real life experience on issues like this. And again, we made that offer as well to work and continue to work with Rachel herself to ensure that she has the confidence that the action we're taking is addressing the concerns that she's raised at this petition. Also, the work that Bobath Scotland are doing in Western Bartonshire has very deep engagement with people and with the condition, and also clinicians in that area, and the whole range of service providers in Western Bartonshire. So yeah, absolutely keen to always engage with people with real life lived experience, because that's the way in which we can enhance services.
Thank you. The petitioner notes in her written submission that she has experienced difficulty using self-directed support to pay for specialist physiotherapy. This is one example she uses to highlight why, in her view, a national clinical pathway for cerebral palsy is merited. Are you familiar with this problem and why there may be confusion about what types of services self-directed support can be used for?
Well, I think we're very clear that the self-directed support guide and the guidance that accompanies self-directed support legislation states that direct payments can be used and spent in a way that that meets provided that it meets approved outcomes, and should be an empowering thing for people with particular conditions. And again, the discussion that we had with Rachel, we undertook to do further work in case that's not understood in a national sense. And we have also worked with COSLA to make sure that we can develop much more consistency around the way in which self-directed support is applied in a more general sense across the country, because self-directed support is the desire and the aim is to make sure people feel empowered and in control of their condition and control of the way in which they can get help.
Thank you.
Okay, Martin Fraser.
Thank you, Convener. Good morning. First of all, just to put on record my thanks to yourself, Minister, and to the officials the opportunity to meet with the petitioner yourself a couple of weeks ago, and prior to that with officials. That was very helpful. Just reflecting on some of the exchanges we've just heard, I think in my experience of talking to Rachel, I think her biggest issue was her inability to find anybody within the NHS who had the correct knowledge and expertise to try and address her issues. It was different when she was a child, but when she made the transition to adulthood, it just seemed to be nothing available and no one to even point her in the right direction, which really is what led to the petition being taken forward. And she was left having to source specialists, for example, in physiotherapy herself, and in some cases travel quite large distances to get the specialist treatment that she needed. There's two issues that have come up, which I'm quite keen to focus on. The first is this question of the local pathway that you're talking about. The petitioner was very clear. She felt there was a need for a national clinical pathway. I think my concern about going down a local route is if you're then leaving it up to health boards to develop this themselves, what confidence is there that they will actually take this up, given Rachel's experience so far in Tayside, which I'm sure is not atypical of what might be happening elsewhere in the country. And I think the whole point of having a petition that was based around establishing a national clinical pathway was to try and ensure that there was some uniformity of care and support for CP sufferers right across the country. And the second point, which is the one the conveners touched on already, is the question of timing, because I think we'd want to know that there's some degree of urgency going to be put behind this. That what we've heard from yourself, Minister, has been encouraging in terms of the work going on, but we don't want to be coming back in 5 years' time finding that very little's happened.
No, yeah, absolutely. And because people will be going through transitions now, and we don't want to hear more stories like Rachel experienced. So I agree that there needs to be pace injected into this. We're coming to the end of that pilot, so we'll be able to then move forward on ensuring that there's a better national understanding, that there are there are ways in which we can build a framework that has that national prominence for local NHS boards or local providers to understand. But again, it goes back to the points that Gregor made around that local clinical pathway needing to be based on cognizance of the individual's condition and the local support that can be brought around them. So it needs to be, you're right though, we need to drive this in a national sense too, and I think that part of that is also about making sure people have a better understanding of the condition, that there's a much more general awareness of the condition too, so that Rachel doesn't feel that she's having to go over what her condition means for her, and that she has to explain that condition to people that she thinks and feels and believes should already have a knowledge of what she may be going through. And I think one of the points that she made was that she wasn't able to speak to anyone who was able to tell her what other related conditions she should anticipate as part of her cerebral palsy. So I think on that point we'll certainly undertake to make sure that there's greater awareness raising. I think they'll be able to develop a framework based on the Bobath pilot. I think Bobath Scotland have just launched a new website as well, which although it's for children, we want to explore ways in which we can develop that to be applicable to everybody and adults with cerebral palsy as well. We'll continue to work with Rachel on all of these things to give her the confidence that the pace is injected into this work, so that she doesn't find herself having to resubmit a petition in 5 years' time.
Okay. Thank you. And just so I get clarity on this question of the local pathways you're talking about. I mean, how, what is the role of Scottish Government and NHS nationally in making sure that these are actually delivered by local health boards?
So local ownership is really important in this pathway development, because you rely on local clinicians, local coordinators really championing that, and some of the problems that Miss Watts experienced in terms of that coordination at a local level, the signposting, the availability of services, the visibility of those services to local clinicians. One of the best way of trying to resolve that is by that local ownership and development. And certainly that can be influenced in a variety of ways, through the kind of influence of, if you like, the National Medical Directors and National Nurse Directors Group, who can be, I guess, examined as to where they are in terms of that development and how they assure themselves of the service through the local clinical governance structures. There's also I guess a really strong role here for some of the groups like Capability Scotland to really be holding the local boards to account alongside Scottish Government in terms of the services that the kind of members and the people they represent experience as well.
We also have the National Advisory Committee on Neurological Conditions as well, and I think there may be a role for them to make sure that there's national oversight of the way in which local provision is delivered. There's also a workforce planning subgroup as part of that as well, so that'll give us another opportunity to have a national understanding of that local delivery as well.
I think ultimately our aim is to improve the service that people with cerebral palsy experience, and there's a variety of ways that you can go to do that. If I use the example of another area of clinical practice, for instance respiratory medicine, the pathway work with respiratory medicine I guess started back about between 2006-2008, and gradually across the country we saw huge improvements in terms of the way particularly patients with a condition called COPD experienced care. The formation of the National Airways Group, which represented all those, if you like, all those pathway groups, coming together, sharing good practice, learning from each other, has meant that they're able to kind of take things on further. There was never a national pathway for respiratory medicine, but what happened was that those pathways developed cognizant of local needs, local services, owned by local services, and has taken forward respiratory care there.
I just have one final question, although I do think it's quite remarkable, the suggestion that Capability Scotland as a charity should have a job to hold a board to account, given that very often I would imagine that board is maybe commissioning work from an individual charity. That feels like a very uneven battle to me. Can I ask you whether what lessons have been, are there lessons sort of emerging out of the BOBATH's work at a local level about which local services care would encompass, including health and social care, beyond physiotherapy? I mean, are there early lessons emerging just now that might be worth sharing with those who are concerned about this question?
Well, I think what, Dr Smith said at the start there was around actually the number of ways in which boards can be held to account as well. And I also, in response to Murdo Fraser, did mention the National Advisory Committee as well. So I think it's a bit disingenuous to suggest that we were only and solely looking for Capability Scotland to be holding boards to account.
It would be remarkable if a charity was able to hold a board to account. It would be a first, and most
and actually third sector organisations
I think
involved.
there is an issue about anyone holding a board to account, so that would be an interesting lesson to learn from that. But anyway,
yeah, perhaps. There are early lessons from the BOBATH pilot, which has been ongoing now for around 18 months, and they have been concentrating on working with the workforce, making sure there's a better understanding of the condition around the workforce and understanding where the gaps of provision are. So they've been working to ensure that knowledge is understood about the transitions for people with cerebral palsy. Their phase 2 has been looking at around practical improvements that they can make and what interventions need to be undertaken to ensure that the transition is smooth and that outcomes are improved. And we'll be shortly to get the finalised pilot, and we can share those full learning with the committee if you would if that would be of interest to you.
Okay, unless there are any further questions, Brian.
And I know you've kind of gone over this before, Chair, but I do understand the necessity for delivery of services locally, using local services. What I'm struggling with is connecting the dots up between having a pilot for a local pathway, and as you've said yourself, each local authority will have a disparate pathway to follow, without having and using that to develop local pathways across Scotland, without having at least a framework for a national pathway.
So this is not unusual for the way in which you develop policy and practice as well, that you would have a pilot to test what works, to test what is possible, to understand barriers, to see what more you need to do, what are the unintended things that might crop up through that process, and then to distill that learning and then to share that learning in a national sense with those key principles. So that's why there's a pilot. That's why there has been this engagement with BOBATH Scotland, that they, with the expertise they have on this condition, have been the ones that have been commissioned to provide us in government, before we undertake national policy decisions, to bring about the research, the evidence, the understanding of the condition, what needs to happen, what needs to be improved, and then how we can then share that with other boards so that they can then apply those key principles to their own local clinical pathways to ensure that provision is improved for people across the country with cerebral palsy.
So, but to me, you're describing a national pathway there.
No. Sorry,
I think, as is often the case in these circumstances, Mr. Whittle, sometimes the terminology gets mistaken, and it's really easy to do that. But you mentioned the term, the kind of national framework, and I think that's really important, because what the evidence from a variety of different sources, including what is current practice across the boards, will be able to inform is that sense of a national framework that informs best practice in pathway development, rather than a national pathway, which is something completely separate. National pathway would be a way of delivering care to patients from only one or two providers on a national basis.
Okay, Maurice, briefly.
Thank you, Chair. Morning, Minister. Would it not be sensible, bearing in mind what Mr. Whittle's just said, to run a parallel project, say in Aberdeen or somewhere else in another local authority area, even maybe a third one? Statistically, that is more sensible than relying on one, and particularly Western Bartonshire, which is absolutely my local area. There is a lot of rural part of it, and therefore we're not looking at the conurbations so much. There should be a balance, I believe, to get the right result.
I think, I mean, that might be one option. I guess I'm also kind of aware that you've asked me to inject pace into this as well. you know, the other thing is around that this is based on people, individuals, understanding, as well as working with the clinicians. This is about working with individuals with cerebral palsy, and the expertise and knowledge that Bobath has more generally, aside from this this pilot. So I think together that we will be able to get to a place where we do have an ability to provide something, a framework in a national sense, which takes, you know, that understands the rurality, the complexity of Scotland's geography, the cities, the urban areas as well, the islands too, so that we can understand the condition as best we can, that we can improve it in a national sense. But I'm kind of conscious that I don't think the committee would want me to then undertake more pilots at the risk of delaying those improvements to be seen across the country.
So it's just a pity that you hadn't started off, say, with 3 different areas as the pilot, rather than just one specific area. Because you've got 32 other, well, obviously 31 other local authority areas.
Elizabeth, would you like to comment on the reasons why Western Bartonshire was picked?
It was entirely working with Bobath, because we wanted to look at this, and we have worked with them, and it was their suggestion. So this is how we agreed to go forward. There wasn't a proposal to do it in 2 or 3 areas. I wanted to look at the possibilities, because integration, the joint boards, the community health partnerships all help. They are the commissioners of these services now, so we have to look at it that way. I take your point, though, Mr. Corey, around perhaps we might have looked at doing it elsewhere, but the partner in this case was Bobath, and this was where they proposed to do it. So it's as simple as that, I'm afraid.
Again, Bobath Scotland do have national understanding, in-depth understanding of the condition. They work with many people across the whole of the country as well. So there is that, alongside the individual outcomes of Western Bartonshire pilot, that understanding that they have and that expertise that they have in a national sense as well, which will all work together towards ensuring that we get a framework that's deliverable across the whole of the country. Also, the mapping exercise undertaken by Capability Scotland that is looking to see where provision may need enhanced. Our own undertaking to further enhance that by working with NHS boards right across the country, and also the work that the Huntington Association is doing around frameworks for that condition, which other neurological conditions have said that they would like to use to enhance services for their particular illnesses as well. So I think piecing all of that together puts us in a strong position to then deliver a national framework that understands the geography of Scotland, that understands the desire that we all share to improve services across the country for people that are suffering from cerebral palsy, and addresses the issues that Rachel has raised in her petition around transition, around access to issues like physiotherapy, that sense of powerlessness that she felt as someone experiencing that condition. And I anticipate that this will make the improvements that I hope it gives her comfort, because we will continue to work with her and test that against her expectations.
I'm just concerned, sorry, the final point, that you've slightly been, I wouldn't say led by the nose by Bobath, and I'm not decrying them at all, the work they do, but it just means it takes away from this sort of national picture. That's my concern. I thought you might go out to a bigger area, bigger part.
I though have told and highlighted the fact that Bobath have a national presence, have expertise in this condition, far more than probably any of us round the committee table, and that we are also undertaking to ensure that and test with NHS boards about what they are doing and whether it's appropriate around their transition programmes and how they're helping people to overcome some of those barriers across all NHS boards across the country. And of course there's the other work that we are funding Scottish Huntington's Association to develop their framework, which other neurological conditions have said that they would be keen to use to enhance provision for their own particular condition.
Thank you, Chair.
Okay, thanks. I mean, the only thing I would say is there's a bit of a chicken and egg about this. Presumably you actively chose Bobath to do your pilot, and we'd have a conversation with them about defining what that pilot would be. But we will obviously await the findings of that with interest. I think in terms of time, we have come to the end of this particular petition, and can I thank the Minister and officials for being here. I think we would want to take the opportunity to reflect on the evidence that we've heard, and maybe to test what we've heard here against what the petitioner might respond and others might respond to that. and so we will take an opportunity at a further meeting to decide what further action we want to take. I don't know if there's anything particular either Murdo Fraser would want to highlight to us in terms of that, or the rest of the committee. But I think there's plenty of food for thought there.
Yeah, I think that's been a helpful session. I think there's been quite a lot of information actually that's come out in the course of the last half hour or so. It'll be quite useful to sort of take that away and digest it, and to get the petitioner's view on where we go from here. Yeah.
Okay. Okay, well in that case, I think we're agreeing then that we're going to reflect the evidence from the Minister and decide at that point what further action we're going to take. But again, can I thank you very much for your attendance today. I think it has been a very useful session.
Undertake, convener, to make sure that alongside that thoughts, those processes you're undertaking in your deliberations, that you have an idea of the timescales for when the pilot comes to an end, and learning from that, so that might help with your understanding of how to take this forward.
I think we're particularly happy with your clear view that this will not take 10 years. I think that's probably pretty reassuring to everybody. So with that, can I thank you very much, and can I suspend briefly? Okay, if I can call the meeting back to order. We now move to agenda item 2 on a new petition, and we're taking evidence in petition 1637, ship-to-ship oil transfers and trust port accountability. And can I welcome Kate Forbes and John Finney, who are in attendance for this particular petition. This petition is by Greg Fullerton on behalf of Cromarty Rising. This is a new petition that we're considering for the first time. We will take evidence from the petitioner, who is joined by Duncan Bowers and Lorraine Thompson. Can I invite Mr Fullerton to make a brief opening statement of up to 5 minutes, after which members will have an opportunity to ask questions.
Thanks very much. Thanks for inviting us here today. This petition reflects our experience with a recent proposal to undertake ship-to-ship transfers of crude oil in the Inner Murray Firth. and comes a decade after a similar proposal was rejected on the basis of environmental impacts in the Firth of Forth. So we asked the committee, why has this issue not been resolved in the intervening years? With North Sea ports and infrastructure in need of support, these proposed transfers at sea anchorages bring no new jobs and threaten existing ones. There is no benefit for the areas affected. Businesses and communities, depending on their natural environment, need clarity to be able to make investment decisions for the future. And Lord Donaldson's landmark Safer Ships, Cleaner Seas report, which followed on from a catalogue of oil spills around the UK coast, it was recommended that such transfers should only take place at 2 locations in the UK, namely Southwold and Lyme Bay. There were no sites in Scotland. Ship-to-ship transfers of crude oil in Scottish waters should be subject to both a strategic environmental assessment as well as a sustainability appraisal which considers economic impact. We ask why these strategic assessments have not been undertaken in Scotland. In our experience of the recent Cromarty Firth Port Authority application, there are now 27 Highland and Moray community councils in opposition. There are several high-profile NGOs in opposition, and over 100,000 people have now signed a petition opposing it. In the case of the Firth of Forth, 3 councils representing 900,000 people opposed it, and the issue was raised in the Scottish Parliament. So how can the Scottish Parliament act to use its powers to reflect the will of the people to protect our environment and businesses that depend on it? The matter of ship-to-ship oil transfer, of course, is not devolved. However, environmental protection most certainly is devolved. This leads to significant process anomalies in our view. We're not here to argue for ship-to-ship to be devolved. We simply seek that the Parliament uses its powers to protect our environment. So how can Marine Scotland's SNH, SEPA protect our environment and our designated areas and our wildlife in this situation when they are no more than consultees or advisors in the process? Moreover, how can we ensure our environment is protected in the event that our environmental agencies disagree with the views of the Maritime and Coast Guard Agency, who are the awarding body? Implementation of the habitat regulations in relation to ship-to-ship oil transfers currently requires authority in the discipline area by those qualified in each subject matter. So currently, the Maritime and Coast Guard Agency, who have expertise as mariners, are the competent authority and can override or overrule our environmental experts. So what legislative levers are currently available in Scotland to enable the Scottish Government to contest decisions made by bodies external to Scotland, which may have significant detrimental impacts to the Scottish environment? The recent Inner Firth application has highlighted a number of inadequacies and uncertainties with regard to environmental impact. This is not just limited to the impact of an oil spill, which would be a catastrophe for marine life and businesses alike. There are also significant operational concerns in relation to ballast water treatment, acoustic disturbance underwater, and the discharge of carcinogenic volatile organic compounds into the atmosphere. In the case of an oil spill occurring, the modelling is based on a worst-case scenario of the discharge of 1 tonne of crude oil, even though the tankers that are going to be carrying out these transfers can carry up to 180,000 tonnes. The environmental impact is therefore grossly underestimated. One of the most shocking elements is the potential for euthanasia of whales and dolphins following live stranding due to an oil spill. In order to simplify this petition, we've made a technical submission to SEPA on the ballast water hazards, and we asked the Petitions Committee to obtain SEPA's response as guidance. We ask how the Scottish Government can enforce its own code of practice on non-native species when a decision to allow ballast water discharge is taken by a body external to Scotland acting contrary to SEPA's advice. And we ask further whether the planned euthanasia of European protected species is lawful or indeed ethical when it could be avoided completely. In the case of the Murray Firth application, there is not enough certainty in the process to say beyond all reasonable scientific doubt that there will be no impact on the integrity of the Murray Firth Special Area of Conservation. This is a fundamental requirement, and it is not unique to this case. With process uncertainty, therefore, how can we allow another Scottish Trust port to put forward such an application? The other part of our petition, of course, deals with port accountability. And again, using the Cromarty Firth Port Authority as an example, Cromarty Rising, who we three represent, have written to individual board members, the chairman of the board and the chief executive with regard to their recent application. There has been no meaningful engagement. Transport Scotland has stated that it is up to each trust port to ensure it complies with its own legislation. Is the committee comfortable that an unelected, self-appointed organisation looking after a public asset should be able to police themselves? Transport Scotland has no remit, of course, in disputes, and if stakeholders feel aggrieved, their only further recourse is to take legal action, which is both costly and time-consuming, and we know this. This is wrong. Trust ports manage valuable assets that belong to the people of Scotland. They are managed on behalf of the people, and they ultimately should be responsible to the people and not to themselves. At the very least, there must be independent oversight. Trust ports are responsible to their stakeholders. They can receive indirect public funding via the Scottish Enterprise Network, and all profits should be reinvested in their ports. Their ability to do that should not be diluted by private sector joint ventures or using penetration pricing strategies to the direct detriment of local stakeholder competitors and other Scottish ports. We finish to say, is it desirable or indeed within the spirit of the Harbours Bill that Scottish trust ports should deliberately set themselves up in direct competition to their local stakeholder businesses? And finally, do the committee agree that there is a need for oversight of our trust ports?
Okay, thank you very much for that opening statement. Can I maybe start with a question about existing ship-to-ship oil transfer licences in Scotland? Our understanding is that licence exists for Scapa Flow, Nig and Sullom and our background information indicates that there have been no major incidents at Scapa Flow since 1980. The 86 transfers took place at Nig Terminal between 2009 and 2014 without incidents, and in respect to Sullom we understand that in 2009 there were 2 minor spills in respect of which an investigation confirmed no adverse effects or damage to the environment. So I suppose what I'm interested in is whether you're opposed to all ship-to-ship transfers or are there specific locations and or infrastructure that provide appropriate facilities for this activity?
I think that's the crucial part of it. You need the infrastructure to be able to undertake these transfers safely. At Nig, we have absolutely no issue whatsoever with ship-to-ship transfers taking place there. They have been done safely, as you say, for the last 30 years, tied up at a jetty with the supporting infrastructure there. There are 40 people employed by Wood Group to support the process of ship-to-ship transfers and the former operations of the Nig oil terminal. If this is going to be moved to sea, you're in an open sea situation. The Cromarty Firth Port Authority have no intention whatsoever of using that shore support that is there. They are able to offer the service at a cost which will be something around 1/3 of anywhere else in the UK. And that comes back to my point about penetration pricing strategies. They are going to make it so cheap that it will attract the business in. And it is within a couple of kilometres of a very rocky shoreline. So if anything goes wrong there, with no emergency tug on hand, there will be harbour tugs on hand, then as far as we are concerned, it is a disaster waiting to happen. I think the other issue is that this current application, which has brought us here, there's going to be an 800% increase in the quantity of oil transferred. That's what the application is for.
So part of it's about infrastructure then, an appropriate site.
Exactly.
But are your concerns also about this activity being carried out in environmentally sensitive environments? And if so, what are the characteristics of these environments that you're specifically concerned about?
I think the whole issue probably comes back to the fact that there should have been a strategic environmental assessment carried out. If we are going to undertake this process in Scottish waters, we should have thought about this before we started doing it willy-nilly. And, you know, it should have been done on a UK basis as well, obviously. But I think we've come to the situation that in the Cromarty Firth, it's within the middle of a special area of conservation for bottlenose dolphins. And it's also a special protection area for birds. And we think it's wholly inappropriate that this process should be undertaken in this location when it can be undertaken very safely at the alternative location at Nig. So it's about having that foresight and strategic thought into where we want to allow these transfers to occur, which gives the general public clarity, but it also gives the ports clarity as to where it may be acceptable to carry out.
And just for an idiot's guide for me, assuming, just to absolutely confirm that that strategic environmental assessment is within the domain of the Scottish Government.
We believe so, yes.
So it is possible to have a UK-wide policy where other sets of considerations within devolved powers would address that. We've got examples of that around nuclear power and so on. So this is an area where the strategic environmental assessment could be acted upon in order to address this question.
We believe so.
Okay, that's very helpful. Thanks very much. Angus MacDonald.
Okay, thanks, Convener. At the start, I should declare that as a councillor at Falkirk Council in 2006-07, I was actively opposed to the proposal by Forth Ports for ship-to-ship oil transfers in the Firth of Forth, and I'm on record at the time of opposing the plans. Now, the petition considers the issue from the perspective of using environmental legislation to prevent ship-to-ship oil transfers. And we understand that in respect of some of the areas where ship-to-ship transfers may be proposed, there's existing legislation for environmental protection, but that the licences, as we've heard, for such transfers are a matter for the UK government. Clearly, you've already said that that's your understanding, but would you not agree that, I mean, we know that the Scottish Government has regularly called for the devolution of the licensing powers. Would you not agree that it would be a lot easier for the Scottish Government if it didn't just have to rely on the environmental regulatory powers that it has and had full powers over the licensing? You know, that would help to expedite the whole situation.
I would agree fully with that. It would be much easier if it was a devolved matter, but the fact of the matter is it isn't a devolved matter, and we believe that the Scottish environment would be put at risk by a licence being granted, you know, particularly in the Cromarty Firth, but, you know, not limited to that. The Firth of Forth application could come back, and that is the Maritime and Coast Guard Agency that make that decision. But I think the point is that the Scottish Parliament does have power over the environment as one of your responsibilities, and I think we've got to look at what levers or legislation are available to ensure that our valuable environment and wildlife is protected.
Okay, thank you.
Brian Whittle.
Thank you, Convener. Good morning. If I could turn to another aspect of your petition, you call for reform of trust ports. It would be helpful if you could provide some information about the current status of these ports. The information we have sets out that they are independent statutory bodies run by independent boards for the benefit of stakeholders. I just wonder if that's your understanding, and if so, do you know who the stakeholders are in question?
Yeah, it's up to each individual trust port to name their own stakeholders. So in the case of the Cromarty Firth, it is businesses that use the port, it is customers of the port, it is communities surrounding the port, and specifically in Cromarty Firth, it is the environment as a stakeholder. Obviously, the environment can't speak for itself, but the communities surrounding the port can speak for themselves. And as we've stated, there are 27 community councils that surround the Cromarty Firth Port Authority area in direct opposition. There is one in favour. We see there's something of a democratic deficit there when the Port Authority plough on with their plans in the face of massive public opposition. Do you want to say anything?
Yeah. Good morning. The governance of trust ports, as you rightly said, it's an independent statutory body. However, the Harbours Bill 2015 invoked a repeal of sections 10 and 12 of the Port Act, which basically means that Scottish trust ports are no longer under any pressure from Scottish ministers to be a commercial venture as they were required under the 91 Act. So basically, we have a trust port set up for the benefit of its stakeholders, who has now set up a private company with private investors, which means that 50% of the profits will then return to the private stakeholder rather than all the profits being invested back in the port. And our contention is that the trust ports, whilst they operate in an environmental, commercial environment, and they've got no direct public funding, they do receive indirect public funding from Highlands and Islands, Enterprise, etc. So our main concern is we have a trust board that is supposed to represent and be there for the stakeholders and community, and we have a private company that's been set up by this trust board who has two private stakeholders having 50-50%, and therefore 50% of the profits, instead of all of the profits, will be divided. Now, we would like the Scottish Government to sort of clarify how a Scottish trust port that's set up for the stakeholders and basically is supposed to be independently managed can then set up a private company. And for that private company to then be in direct competition with the local businesses who are sitting on the trust board.
Thank you.
Okay. Rona Mackay. Good morning. Morning. You've kind of answered the first question I was going to ask, which was probably quite a naive one, was why is this happening? And I think you've probably answered it. It's to do with financial. It's to do with money.
Absolutely, yeah.
Yeah. Okay, so can I turn to the sort of accountability of the trust port boards? And you said in your opening statement there'd be no meaningful engagement with them. So I'm wondering what you could suggest at this stage, given we are where we are, to overcome this. And you said maybe independent oversight is what we're looking for. Can you maybe expand on that? What independent oversight you think is appropriate?
Firstly, I think there has to be some governance which basically allows ministers to clearly see that whatever profits are coming back from private companies, albeit that they've got to operate in a commercial environment, that basically we've not got any asset stripping through these private companies. They are set up for the benefit of the community and the benefit of the stakeholders. But if you can just, for a minute, picture the fact you've got a local company who is doing stevedoring services or whatever, and then the trust port comes along and sets up in direct opposition to it, it hardly looks as if it's acting in the best interests of the community. So at some point when they're setting this company up, questions need to be asked by Scottish ministers. Is this appropriate that they are in direct competition, particularly when it's a trust port?
I think the other thing we'd like to see is financial clarity. You know, this is a public asset. These are not private companies. They are set up by acts of Parliament to look after a public asset, and there needs to be complete financial transparency, which there is not at the moment. And when something goes wrong, when, you know, we are just one of several stakeholder groups that are in dispute with our local Trustport, there is no recourse. There's no one to turn to. You know, the Transport Scotland cannot intervene. The Parliament cannot intervene. There is no body. There's no ombudsman there, if you like, independent body that can look at an issue like this and take a balanced view.
In no man's land, really.
Yes.
As far as that's concerned.
So our only option is to take legal action.
Yeah. Okay. Thank you.
Maurice Corey.
Yes, thank you, Julia. Bearing in mind all that's just been said from my previous two colleagues' comments, given a blank piece of paper and a blue sky objective, how would you see the changes to Trustport boards being affected? What would you ideally want to see on those trust boards, and how would they be representative of what you're talking about?
I think we'd like to see them board members appointed through the public appointments. You know, as any other public figure would be. At the moment, the boards, the ports appoint their own boards. There's no transparency, there's no public scrutiny there at all whatsoever. And I think we'd like to see the stakeholder groups better represented. If you look at the Cromarty Firth one, for example, at the moment, 5 out of 8 or 5 out of 8 of the members, I think it's 5 out of 8, it's more than half of the members anyway, are from an oil industry background. There is no one there that represents communities. There is no one there that represents competing businesses, and there is no one on that board that represents the environment.
Right, so you're basically saying a representative on the board from each of these sectors?
I think there should be a better representation, and I think there should be more public transparency in the way people are appointed.
Right, okay, thank you.
Thank you, Convener. Can I thank you for the meeting this morning? And it's to say that I don't know if the committee is aware that there is indeed a live case about the whole issue of Trustports that's just been, to my understanding, still live at Tain Sheriff Court, which would involve, but it shouldn't intrude in the deliberations of this committee. Can I ask the petitioners about the issue of, and it's not to presume that there's not an understanding of this, but the port of Cromarty Firth is different. The port of Cromarty and indeed Invergordon and Nig is different from the area, the geographic area of this proposal. Can you outline that a bit, please?
Absolutely. So Invergordon sits at the head of the Cromarty Firth, along in the western extent. The proposal to undertake ship-to-ship transfers sits at the mouth of the Cromarty Firth, pretty much opposite the village of Cromarty, but also on the other side, opposite Nairn and the whole Murray coast. So it is not really the villages of the Cromarty Firth that are affected, or it's not only them that could be affected, it is also the whole Murray coastline. The ship-to-ship transfers sit bang in the middle of that geographic area.
As a layperson, I'd call it the sea.
Yes.
Is that a reasonable... yeah. And can I ask, therefore, what your understanding is of the community engagement by the Port of Cromarty for the Port Authority? The initial engagement wasn't with the communities around the area of the proposal?
No, the first the communities knew about this proposal was an advert, a statutory advert that was seen in the Inverness Courier the week before Christmas. Completely accidentally. The Community Council was not consulted in any way, shape or form until it was raised internally within the village of Cromarty, and our Community Council had to contact the Port Authority. The Port Authority on several occasions have refused to come along to an open public meeting and discuss this issue openly. They have come to a closed meeting of the Community Council, which had to be unminuted. take from that what you want. And all the way along, we have, as I say, we have written to the board, each individual member of the board we have written to the chairman, and we have written to the chief executive, and never had replies to any of our questions.
And if I may, just to reinforce a question the convener asks at the outset, it's not the position of Cromarty Rising that they have, or there ever has been, a concern about the relative safety of the procedure being undertaken at Nig Harbour?
No, absolutely not. They can carry that on all day long.
Okay. Can I then ask, I think most likely to be Mr. Bowers, I don't understand the mechanics of all this, but the modelling around any spillage, we heard is about a tonne, and we've heard that the tonnages that's involved. Are you able to, maybe for the committee's benefit, say something that I've heard you say at other meetings about the number of seconds it would take to close down valves and what the implications of that would be?
On spills, there's a couple of things, and it comes back to a point we raised earlier. We went back and looked at the Orkney Isles licence application in 2014, and a risk assessment was done by an oil spill service provider, and they estimated that from ship-to-ship transfers there you could lose the entire ship. So they put a figure of 300,000 tonnes would be the worst case scenario. And that was actually signed for and accepted by SEPA and by SNH officers in June 2014. Then 6 months later, the maximum spill volume was changed to 1 tonne by the regulator. And we think that's an enormous difference between what the Scottish agencies think and what the regulator thinks. That's a very big difference.
And what's the speed of transfer? Because it's on the open sea, there are ships side by side, anchored.
The figures there's no clear figures in the application, but if you take the volume and the time, it works out about 2 tonnes per second they'll be pumping between the ships.
So to remind us that what we're dealing with is the general issues that come from specific applications. So this is obviously information, but we're not investigating an individual Port Authority, but we're learning lessons from it in terms of what the Scottish Government might do.
Yes, I understand, Convener, yeah. And finally, if I may then, fairly recently there was on a committee that I'm involved with, we deliberated over a decision of Aberdeen Harbour Trust and on a very sensitive environmental issue, which the committee approved. Are you aware of that at all?
No.
No. Okay.
No.
Thank you. Okay.
Thank you very much. The petition summary identifies that this petition is calling on the Scottish Government to look at how environmental legislation could be strengthened. In terms of your experience through this process, what kind of devolved powers would you want to see exercised more fully?
Well, the National Marine Plan, I think, would be the beginning point for everything marine. Do you want to say on the...
Yeah. The Marine Scotland Consequential Orders 2010 actually empower the Scottish ministers to, which has been agreed in, I think it was 2015, that any reserved matters by public authorities must be dealt with the same as public authorities would deal with them for a devolved matter. In other words, we've got the 2010 regulations and we've got the Scottish regulations. At the moment, we can't look at a reserved matter. However, under our Marine Scotland Act, there are regulations that ensure that public authorities, whether it's a reserved matter or not, must conform to what is contained in our National Marine Plan. And therefore it is Scotland's way of ensuring that when these bodies consider, for example, this application, they must take cognizance of our Marine Plan. And therefore our Marine Plan says we are protecting the environmental species. We don't want invasive species from ships through ballast water, and they have got to take all that in. So even though it's a reserved power, the order that has been passed enforces that the UK government agencies must apply the same scrutiny as the Scottish Government organisations. But it is in such a diluted way that to look for it in the legislation, it's lost. And we need to be able to get to the point where that is highlighted, because in actual fact what we have is we have a competent authority in England who is making a decision about a Scottish marine protected area. But the Scottish Government is the body who actually issues the Environmental Protection of Species licence. So we've actually got two competent authorities, one saying yes, we'll give agreement, but we could have our Scottish Government saying no, we're not going to issue a licence. Now, as part of the 2010 regulations, there is provision for coordination where there are two competent authorities. And I think that whole area of coordination needs to be explored and needs to be developed until we get a completely, fully devolved version of the regulations.
Presumably if it was fully devolved, you might find there was conflict within government, which might be easier to manage, I guess. Is there anything else, Kate?
Really briefly, in terms of engagement by public bodies, so SEPA, SNH, very briefly, could you sketch out for the committee what their views were?
SEPA objected. SNH had felt they couldn't object because they're only operate in an advisory capacity, but they had a very lengthy 8-page response to the application that raised very significant concerns, and Marine Scotland put in no response whatsoever.
Thank you very much. I think we've come to the end of our questions, so can I thank you very much for your evidence. I think that has been very useful, and there's clearly areas here I think that the committee would want to explore. Might I suggest the initial starter when we write to the Scottish Government to seek their views on the action called for in the petition, that we contact the relevant stakeholders, Marine Coastal Coast Guard Agency, Scottish Natural Heritage, UK Harbour Masters Association, and I think you made a specific point about SEPA.
And Marine Scotland.
And Marine Scotland. Are there any other actions that people would like to suggest?
From my formality, I'd just like to understand whether or not the Scottish Government has the authority through the environmental legislation to prevent ship-to-ship transfer, oil transfer. I'd like to test that to see whether it's...
Okay. I mean, I'm thinking of the parallel around nuclear power stations, where establishing a nuclear power station is a matter for the UK Government, but the Scottish Government's made quite clear that it would use planning legislation to block it. So it's whether that is that an equivalent relationship where you say, well, environmental damage is such, that simply won't happen. And there are a series of questions around the harbour authorities themselves, which we might want to explore further with the Scottish Government. So with your agreement then, we're agreeing to write to the Scottish Government, seek its views on this question, and the agencies and organisations has been identified. And this will be something that obviously the Petitions Committee will come back to. But in the meantime, can I thank you for your attendance, and can I suspend briefly? to order, and we move to agenda item 3 on dealing with current petitions into which there is no evidence. And we're dealing with agenda petition 1408 by Andrea MacArthur on updating of pernicious anemia, vitamin B12 deficiency understanding and treatment. Members have a note by the clerk and the submissions from the Scottish Government and the petitioner. Members will see from the submissions that the petitioner is seeking a new method of diagnosing and treating pernicious anemia. Since she lodged the petition, the British Society of Haematology has published new guidelines. Initially, the Scottish Government took the view that the format of the BSH guidelines is inappropriate for use in a practice setting, and that its recommendations for second-line testing is not standard in Scottish laboratories. For this reason, the Scottish Haematology Society was given the task of summarising the BSH's guidelines for use in Scotland. The Scottish Haematology Society has completed this task. The petitioner has expressed concern with the contents of the guidelines and the draft summary document. In this context, the Scottish Haematology Society has noted it is not able to contribute any further to the process, citing its limited resources. The Scottish Government does not seem willing to publish the draft summary document and suggests that the BSH's guidelines will suffice. It is not clear why this is the case, and the petitioner is dissatisfied with the lack of progress on this issue and the Scottish Government's engagement with her throughout the process. And I wonder if members have any views on what action we might take on this petition.
Come
yeah, I think that would be useful, because there's a lot here that perhaps we're not getting to the heart of. Some of it's very technical. It does seem odd that the BSH's guidelines weren't appropriate and now are. Now, there may be something very simple explanation for that that would be worthwhile pursuing with the Minister.
Do we know why the Scottish Haematology Society's work's not been published? Was there a reason given for that, or was that the lack of resources?
I don't think we know that, and I think they have now stepped back, and I suspect my sense would be that they're having ownership of these guidelines and having to deal with questions and the kind of back forward round that, and maybe they feel that they're not in a position to be able to. I think they were trying to provide a service, is my sense, and they're at the centre of it.
Decision not to make this report public, is it?
Well, as far as I understand, that they don't seem to be willing to publish the draft summary document, and it might be worthwhile exploring that. And it would give us the opportunity again for the petitioner to perhaps and it's already given us lots of evidence, but in terms of a focus for the session with the Minister, that might be useful. Is that agreed?
Yes, that's agreed.
Okay, is there anything else we'd want to do? I think probably that feels to me to be the best opportunity. And also we have this briefing, but again we maybe look to some extra information about, actually, if there's any more information about why we've got to where we are, that would help our deliberations, and perhaps to ask the Minister ahead of the meeting if there's some clarification around that. Okay, if that's agreed, we can move on to petition 1591. The final petition for consideration this morning is petition 1591 by Katrina MacDonald on behalf of SOS NHS on major redesign of healthcare services in Skye, Lochalsh and South West Ross. And can I welcome Kate Forbes and Rhoda Grant for this agenda item. Members have a note by the clerk and the submissions from the Cabinet Secretary for Health and Sport and the petitioners. Members will recall that our previous consideration of this petition in December, we agreed to write to the Cabinet Secretary, inviting her to respond to the points raised in the critique provided by the petitioners and to address concerns on patient transport provision. In the context of the decision-making process, the Cabinet Secretary is quite clear in her view that she cannot reasonably add anything to what she has already communicated in previous submissions to the committee. She notes that, with regard to patient transport provision, the Scottish Ambulance Service has confirmed that it has 2 service vehicles to cover the region, both with stretcher capabilities and covered by 3 full-time posts. She indicates her understanding that the service will, quote, work with NHS Highland and other partners to deliver services which support the public and local communities. The petitioners consider that the Cabinet Secretary has failed to answer specific key questions and has ignored the, quote, fundamental issues set out in the critique submitted on 8th December last year. They identify 5 areas that they feel have not been sufficiently addressed. A response to the critique, the mandatory guidance in the Scottish Capital Investment Manual and the Treasury Green Book, a failure to include evaluation of the relative costs and risks of the possible locations for the new hospital, the role of the Scottish Health Council, and concerns highlighted by elected representatives. And I wonder if members have any views on what action we might take on this petition. Angus?
Yes, thanks, Convener. I mean, clearly from the Cabinet Secretary's letter, she says in it that she remains content that independent scrutiny would not significantly contribute to the local consideration of options. And she goes on to say, with regard to the Scottish Ambulance Service, that NHS Highland will continue to work with the service and other partners to deliver services which support the public and the local communities in Skye and Loch Alsh. So I think, given the Cabinet Secretary's assurances and also her statement that the decision to approve the Health Board's proposals has been made, there's little more that this committee can do other than write to the Cabinet Secretary along the lines that you've suggested, Convener, to allow NHS Highland and local stakeholders to move forward on the issue together.
Okay, I don't know whether either Kate Forbes or Rhoda Grant, from their perspective, would want to perhaps help us in our deliberations. Rhoda?
Yeah, I mean, there is still real concern within the community, and indeed things that are happening recently isn't providing any comfort to them at all. We hear about there being 2 ambulance vehicles supported by 3 full-time staff. Well, 3 full-time staff for 2 ambulances, you don't really need to do the maths. There's press reports last week from the ambulance staff who are now being balloted for industrial action, saying they're falling asleep at the wheel. What happens is quite often those ambulance staff are not just taking people to Broadford or Portree Hospital, they're taking them to Inverness. If they're in Inverness and a 999 call comes, they have to attend it as being the closest vehicle to that. So they can be off island. It's not without reason that both ambulances could be off island. Now, if those staff report fatigued in Inverness, they're not allowed to travel home. So there's a huge disincentive for them to report fatigued when they're in Inverness. So they are on duty until they can find a window of opportunity to get back home, leading to many of them reporting falling asleep at the wheel trying to get home. So that's the kind of situation, you know, and when that service is being put forward as comfort for this new setup, you can just imagine why the community don't feel particularly comforted. And neither do they see the services that, you know, I think I've said before to this committee, we've waited a long time for the new hospital in Skye. And, you know, while it's not ideal, and I understand what people are saying, a further delay is going to impact on patient care. It already is. Procedures are now being moved back to Inverness that could take place in Skye. But, you know, there are big issues about how patient care will be dealt with and what care is going to be available in the north end of Skye, where people have been used to having their own hospital. What patient transport, because one of the issues with the emergency ambulance service and why they're balloting is that they feel that they're being used as a patient transport service rather than an emergency service. So there is not enough resilience in the other services. GPs out of hours, you know, RASI, I think, came up at the last committee, where there is no health cover. Out with the hours of 9 to 5, there is no qualified health professional on that island. Again, their help comes from Portree at the moment. It would have to come from Broadford under the new setup. So there are a lot of unanswered questions here, and I can understand, you know, but rather than hold back the building of the hospital, which I think has to go ahead, I think we need a lot of security around what is going to be there in the north end of the Skye and RASI, and indeed what support is there from the other services like GP services, out of hours, NHS 24, Scottish Ambulance Service, and the like. You know, that is really, and you know, it gives no comfort to the community at all.
Kate?
Just for the sake of the committee, I wonder if it's helpful to break down with sort of 3 different strands of concern that are here, because it can get quite complicated. The first is the current healthcare provision. The second has been the decision-making process to get to the point we're at now. And the third is the location of the new hospital. And in terms of current healthcare provision, I think I would echo everything that Rhoda has said, particularly on the emergency and out of hours. I'd also add to that my own concerns with palliative and elderly care. So there are reports that I have not been able to verify today in the West Highland Free Press that the only 13 beds that are available in North Skye in terms of elderly care at the Haven, which is apparently due to close in 3 months. So in terms of provision in North Skye, these things, whether it's ambulance or beds closing, or the fact that a ward had to close in Portree Hospital because of staff being unavailable, all cause quite tangible fear in the north of Skye, which is where there is the population density. So care beds, transport and emergency and out of hours care. But in terms of the decision-making process, which is really what the petitioner is picking up in her response, is the concern that the mandatory guidelines in the Scottish Capital Investment Manual haven't been followed. Now, I think that's the issue that the committee needs to decide on today in terms of how they take that forward. And the third thing is the location of the new hospital. The Cabinet Secretary said that there will always be disagreement about where the new hospital is located, if it's in Broadford or in Portree. The questions, the bigger questions, are whether there is sufficient health services in the north and south end of Skye in terms of dealing with transport, in terms of offering enough care beds, palliative care, and whether there's enough stakeholder engagement in north and south ends of Skye to ensure that there's a confidence in the service redesign going forward. So I echo Rhoda's points on the first point, which is current healthcare provision, which is causing genuine concern in the North End, particularly around care beds and ambulances. The petitioner picks up on the decision-making process and the mandatory nature of the SCIM. And then thirdly, the location of the new hospital has got to have more clearly and more substantial promises of services in terms of care beds in the North and South End.
Okay, I think that's helpful. Can I maybe suggest that one of the things we would want to ask this Cabinet Secretary to reflect on are these concerns, simply the consequence of the decision of where the hospital is going to be, what the provision looks like across the island, not just the ambulance issues. So these would be a matter of concern if an unintended consequence is that you actually are centralising service which in the past could have been delivered within Skye, and the whole question of ambulance and the conflating of that with patient transport service. So we'd be looking for reassurances around that. The argument on process, presumably is as a consequence of an objection to the conclusion. So the reason the petitioner has raised the issue of process is because they're not happy with the conclusion of where the hospital is to be sited. So we have to identify, the Cabinet Secretary, as Angus says, is absolutely clear that process has been followed. And others are saying, well, no, it hasn't been. That almost feels to me that would be decided, in a judicial matter. I might be wrong, but that feels to me, how do you make that decision? We can certainly ask the Cabinet Secretary to clarify the points that, again, that have been raised, but it doesn't feel as if the local members are asking us to focus on that, but to get reassurance around the consequences of that. And I think the point has also been made in our reflections before, it's clearly that while the Cabinet Secretary says, well, I'm absolutely clear, I've done the right thing, and this is a decision, if people locally are unhappy, what responsibility has the Scottish Government got to bring people together and to give them those reassurances? And that might be something we'd want the Cabinet Secretary to reflect on, that while they feel they've legally done the right thing, within Skye area there's still a fracturing of relationships and no confidence in the health board and not proper understanding of the consequences. And we wonder whether maybe the Scottish Government would see they had a role in trying to pull that back together again, and an expectation from us maybe that we would get a report on that, if that feels...
Is the Cabinet Secretary aware of all the points that Kate and Rhoda have made? I mean, the decision was a decision based, despite everything that was said and these views put forward.
Yeah. I'm assuming that what you're saying is that these are not insurmountable. They may have been used as arguments for the siting of the hospital, but once the hospital is sited, you still have to address the question of ambulance driver
It's the
fatigue.
transport side of it and current services. I'm just wondering if all that's been thought through.
There are examples in my own city where everybody agrees a hospital should be built. There are now consequences to that which might not have been envisaged, which then have to be dealt with in terms of provision. I mean, I don't know whether that's your suggestion, Kate.
Last time I had a meeting with, I asked the question of whether the main concern was current healthcare provision, decision-making process of the location of the new hospital. And the current healthcare provision always comes into it. So if you feel confident that the services will remain locally, and if you feel confident that you are not going to be disadvantaged about the location of the new hospital, then there's far more confidence in the redesign. And that's why I think the critical thing at the moment is to ensure that there is confidence that somebody in staffing will not, be risking their lives because of where they live. That's what it boils down to. And the recent changes in terms of the unfortunate situation of having to close beds in Portree Hospital due to staff being off, as well as new reports of the care homes that are there closing, and the very, very serious issues with the ambulance service are just, making confidence fall even further.
Okay. Can I suggest that we write to the Cabinet Secretary in those terms on the specific issues around the consequence of the decision and what reassurance they can give round provision, but also that we feel there is an issue here about there has been a fragmenting of confidence in the process, and while the Scottish Government is confident in their view, we wouldn't know the technicality of that. We do think they have a job in trying to bring people together. Would that be reasonable? And then we can perhaps get a report back from the Scottish Government in that regard. Would that be okay? Okay, if that's the case, can I thank everybody for their attendance, particularly Rhoda Grant and Kate Forbes, and can I close this meeting?